Let's talk about electrical stimulation. Electrical stimulation is a great tool to use to get a muscle moving again. It has a lot of benefit and it does not hurt. So I got this TENS unit off of Amazon. It's really easy to use and I didn't have to do any additional setup. And we will link this in this module so you can find it. So essentially, all electrical stimulation does is it moves a muscle. So if I was, let's say I had a normal movement in my arm. If I wanted to move my arm up, my bicep has to tighten or contract for that to happen. So if I get electrical stimulation pads and I put it on my bicep, the impulse is just going to help that bicep move or contract. It should not hurt, and we are going to take you through the different areas of the body that you can safely put this on. Another thing is, when you do get it, it's going to come with these wires. So these wires have a black and a red end, and then this prong. This prong is going to simply plug into the hole. I like to use one at a time for simplicity, but if you wanted to, you could get more complex and use 2 cords and 2 electrodes. But for all the videos we show you, we're going to go super simple with it. So you plug the prong in, and then this little dial helps to increase intensity or decrease intensity. And again, I didn't mess with anything. I literally opened it up, plugged the prong in, and then I have these wires. So for the wires, you're going to take the black prong and plug it into an electrode pad. And then you're going to take the red prong and plug it into an electrode pad. Super simple, right? So I'll just show you for demonstration purposes on me first. But I was taught in school to do the black electrode on top, so closest to the torso area, and the red on the bottom. But it really doesn't, if you get a better connection by flipping that red on top, black on bottom, that's totally okay. So what you're going to do is you're going to take an electrode and place it on a meaty part of the arm. You never want to go on a bone, it just should feel super meaty. And then you're going to take the other prong and find another spot. Don't be afraid to do this because you can always readjust. So let's say I did this and I wasn't getting good movement. I could say, well, hey, maybe I need to go in a little more and up a little higher. Okay, don't be afraid to do that. But always turn the machine off before you do that. So what I would do is I always place the electrodes on the person and I say, okay, I warn them, I'm going to turn it on. Once you turn it on, you ask them when they feel something. Okay, once you feel something, I would say, okay, I feel it now. I feel a little pulse. It just feels like a tingly pulse right in the muscle. And now I'm not moving my arm. This machine is actually starting to move my arm for me. Because again, it's sending an impulse to my bicep and saying, hey bicep, I need you to move or to contract. So let's get started on all the areas that you can safely place an electrical stimulation TENS unit on a muscle to get it moving again. One more thing. On the next slide, we show a list of contraindications and precautions when using electrical stimulation. So you always want to get this cleared by your doctor. A contraindication means you absolutely should not be using an electrical stimulation or a TENS unit. So for example, if you have a pacemaker, you're going to have to ask your doctor if you can even use this. And typically the answer is absolutely not. So you should not use an electrical stimulation TENS unit if you have a pacemaker because it can mess with it. So those are the list of contraindications. Talk to your doctor before doing this. The precautions are just things to think about before doing this. So although it's not an absolute no, you shouldn't use the TENS unit, it's definitely something you still want to bring up with your doctor. So for example, if you have cancer, but maybe it's not cancer in the arm or the area of the skin that you're doing, it's somewhere else in the body, you want to call your primary care physician and say, hey, can I use this on my arm? So please, please, please make sure you take a look at that list and talk to your doctor before doing this. Placement number 1, so there's 2 placements I would recommend for the shoulder and the shoulder blade. Again, super effective position. You can do it sitting up or laying down. I do prefer laying down. I think you get a little bit more access to the muscle, but you can do it either way. So if you feel, when you're feeling the back of the person's shoulder blade, you can feel a bone here, okay? It's super rigid. It's right here. So all I'm going to do is I'm going to find a meaty part of the muscle, which I like to go back here. And then for the other one, I'm actually, so here's the bone, here's a meaty part, and then I like to go to the back of the shoulder. So this is the first one. I'm going to take the unit. I'm going to start by turning it on. And let me know when you feel it. The pattern here is you always ask the person, when do you feel it? And then once they feel it, you're going to start moving it up to see if you can get the electrical impulse to move the muscle. So remember, if you can move the muscle 1,000 times using this impulse, the brain is going to really start to fire and it's going to remember how it's supposed to be moving. So do you feel it yet, or not yet? Okay, so I'm going to keep moving up. How about now?
Yes.
Okay, you feel it. So now that she feels it, you're going to slowly start increasing it until you start to see it move, or until she says that feels good. So remember, even a feeling sensation of this electrical impulse is just as good as a movement one, but we want to see a movement if possible. Oh, so you can see I'm seeing some movement. Does that hurt?
No.
See, now you can really see that movement. I would leave this on 10-15 minutes. I am simply reminding the shoulder, hey brain, this is how this particular muscle is supposed to move. Again, it should not hurt. So if you put it on a bony area, it may be uncomfortable, and the person can just say, hey, that's uncomfortable. So that's the first placement, so let's move on to the second. The second placement for the shoulder is I, again, always feel for like a soft, meaty part. This is super meaty at the top of the shoulder for the muscle. And so you're going to place, I like to do black over red, so I like to put the first electrode here, and the second one I like to find a meaty part of the shoulder over here, so the middle of the arm. So you should see these almost directly across from each other. Again, you're going to ask them if it feels comfortable as you turn it up, and then once they feel something, then you're going to go for a movement. So let's start with turning it up. Let me know when you can feel it.
I can feel it.
Okay, and now we're going to start to move it. Oop, can you see that? What incredible movement. Does that hurt?
No.
Okay, that's the second placement for the shoulder. You can see I am not moving it. She's not moving this arm. This is purely the machine. So let's move on to the upper arm, and there's 2 placements for the upper arm. So I'm talking about the area between the elbow and the shoulder that I would recommend putting the electrodes. One is the back of the arm, and this muscle back here is called your tricep, and the other is going to be for the front of the arm or your bicep. So let's start with tricep. So for tricep, again, I like to do black on top and red on bottom. You're going to place the electrodes on a meaty part of the muscle. Don't forget too, if you don't like your placement, turn off the machine and place it somewhere else. And another trick is if you do a little pen mark or a marker, you can actually mark where you get the most movement with the electrodes in the muscle, so you can place that on there as often as you want and accurately. So again, I put her on the side. I'm gonna, the pattern here is to turn it on, ask when they can feel it. Once they can feel it, then try to get it to the point where you see a movement in the muscle. So she is not able to move her arm. I'm going to turn on the machine. So I'm going to let her know I am turning on the machine.
Okay.
Let me know when you can feel it.
I can feel it.
Okay, you can feel it now. We're going to see if we can get a movement. Whoop, there it is. Beautiful. Now, all this is doing is, as a movement signal is getting shot up to her brain, and then the signal is getting shot back down, and the brain is remembering, this is how my tricep is supposed to move. This is what it feels like to move my tricep. And the beautiful thing about electrical stimulation is I'm not doing it to her, so it's even more real for her brain instead of me moving it. And finally, think about it's moving. it's moving, it's moving, it's moving, it's moving. It's going to do that 1,000 times, or that would be really hard for me to do for her arm. So there's placement for the tricep. Let's move to the front of the arm or the bicep. So for the bicep or the front of the arm, you can do this on your side or laying down, but I'm showing you for demonstration purposes on her back because it's easier to see. But again, you're going to take these electrodes. I like to do black over red. You're going to find a meaty part of the bicep or the front of this upper arm, and you're going to take her through the same exercise. You're going to say, okay, I'm about to turn on the machine. Let me know when you can feel it.
I can feel it.
Okay, so now I'm going to, once you can feel it, as long as it's within comfort, I'm going to start moving it up until I see a movement. Ooh, that jumped a little bit. Did it hurt or was it just scary?
No.
Just a little scary. You can see, if you look closely, there's a movement. Now, sometimes that initial movement will scare the person, but can you guys see the movement in here? Can I go up a little more? Does that feel comfortable?
You could go up.
There we go. You see that bicep? Again, you can do this session. You can do about 10 to 15 minutes per session. Do this 2 to 3 times a day, really as many times as you want. And again, all this is doing is it's reminding her brain and saying, hey brain, my biceps moving, my biceps moving, my biceps moving. This is what it feels like to move my bicep, to move my bicep. For an individual who has no movement in their arm, it is an incredible tool, electrical stimulation, to remind that brain how it's supposed to be firing to move that hand again. Let's move on to the lower arm or the forearm. So I have her laying on her back for this demonstration, but you could have the person sitting up or laying on their side. But again, you're going to take the electrodes. I like to do the black over the red, the cord. You're just going to find a meaty part of the arm. You're going to place those. You're going to go through the same routine. You're going to turn it on. You're going to let her know I'm turning on the machine. Now let me know when you can feel it.
I can feel it.
Okay, and now we're going to start to get it to move. I'm going to move it up. Oh, you see that? Are you moving your arm? The machine is moving her arm. You can see this movement here. It's reminding the brain, and it's actually moving the fingers at the same time, which is incredible. So it's a good placement for her. So again, 10 to 15 minutes a session. You can do it a couple times a day. Great, great way to remind the brain how that forearm is supposed to be moving. So the second electrode placement for the lower forearm is the back of the forearm. So here's the front where the palm side is. So you're going to put the person with the palm down. I'm doing this demonstration on your side, but you can again do it sitting or on your back. So the back of the forearm, you're going to find a meaty part of the muscle. I like to do black over red. Okay. You're going to find a placement and you're going to try it out. So same thing. You're just going to say, okay, I'm turning the machine on. Let me know when you can feel it.
I can feel it.
Okay, and now that she can feel it, again, that's still incredible in itself because we're sending a feeling signal up to the brain to remind that about this movement of this particular muscle. But now what I'm going to do is just I'm going to move it up and see if I can get a movement. Oh, see this? Can you see her fingers moving? I am not moving it. She is not moving it. She is moving those fingers. Now, if the hand's moving in an awkward position, you can position. So like if I hold it like this, you see how the hand's coming back. So this particular placement helps with opening the hand. So if you're having a hard time opening the hand, you're going to do this motion. But again, look at this incredible movement we're getting here. That brain is just getting signal shot up, and it's loving it, and it's going to get that arm moving again. An incredible tool if you're not moving that arm at all. Let's talk about electrode placement for the hand. So again, the hand, you never want to do the back of the hand because it's too bony. And so if you remember, anytime I talk about electrode placement, I'm always saying find some meaty, fatty part of the arm or the hand. So for this, you can actually do different areas. So I'll just show you an example. Let's say I put the black, see this black electrode up top. I can place this red one maybe by the thumb. Maybe I'm placing it up a little more towards the fingers. Maybe I'm going smack dab in the middle. You can move it to the side to kind of remind Pinky how to move. All you have to remember is wherever you place these electrodes, that stimulation is going to happen between the two, and then it's going to get the muscle to move. I'll show you, for example, the front, the pad of the hand, and what we're hoping for is just a movement in the fingers. So to start, I am going to turn on the machine. Let me know when you feel it.
I can feel it.
Okay, now that she said she can feel it, I'm going to move forward and see if I can get the hand to move. All right, now are you moving your fingers at all?
No.
Does it hurt?
No.
See how we're really getting a lot of thumb, right? A lot of thumb movement. Maybe we move that down a little bit. If I wanted it to move somewhere else, I would simply move the pad. See that thumb? It's kind of heavy placed over here. I can show you one more placement. You can take it and put it out towards the pinky side. You can move this maybe up a little more. Let's try this one. Turning it on. Let me know when you can feel it.
I can feel it.
Okay. See how we're getting a little bit more movement in a different way, a little bit more pinky. And I'll show you one more quick one. Sometimes what I like to do is I like to take this one and I like to place it on the outside of the elbow. So when you're talking about the outside, I'm talking about the thumb side. This muscle right here helps to move the fingers. This is the insertion point. So sometimes I like to do a combination of forearm and hand. And again, you can't mess it up. Just make sure it doesn't hurt the person. It's on the meaty part of the arm. You can do 10 to 15 minutes a session multiple times a day. Okay, I'm turning it on. Let me know when you feel it.
I can feel it.
Okay, now I'm going to look at that. Just getting some great movement. Her thumb's involved, her forearm's involved. As long as it doesn't hurt and it's not too much for her, then you're good to go.